Good afternoon, Mr. Hernandez. My name is Nahara. I'm going to be your RN for today, and this is Daniel. He's going to be the LPN assisting your care. Can you please go ahead and confirm your name and date of birth for me? All right, great. Well, it's very nice to meet you, Mr. Hernandez. I'm going to be starting off by completing the head-to-toe assessment, and in the meantime, Daniel's going to be taking your vitals. Daniel's also going to be coming in to take your vitals about once an hour throughout the remainder of the day. Alright, Mr. Hernandez, so I did just review your medical record, and it does appear that the doctor asked for you to be started on IV antibiotics as well as oxygen at 2 liters via nasal cannula. Our LPN Daniel is going to be setting up your oxygen now as well as your IV. Now, what I need for you to know is that during the IV, if you feel any discomfort, dizziness, please go ahead and use your call button so that one of our nurses can come in and check on you.
Okay, Mr. Hernandez, I'm gonna start your IV right now, and then I'm gonna have 2 of my assistants. They're gonna come in and they're gonna wash you up and check your urine output and make you a little fresh, okay?
Hello, Mr. Hernandez. I am Miriam, and this is Annalise. We're going to be your the CNAs for today.
Hi, Mr. Hernandez, the LPN. Let us know that you need to use the bathroom. We're here to assist you to the restroom.
Hello, Mr. Hernandez. Now that we've assisted you going to the restroom, we're going to help you on with your bed bath. Are you available at the moment?
Okay, Mr. Hernandez, so as I saw in the assessment, you do have a stage 1 wound, so what I'd like to do now is go ahead and take care of that wound. I'm going to redress it to make sure that it does not progress and get any worse than it is right now. Hi, Miriam, my name is Nahara. I'm going to be your nurse for today. Can you please confirm your name and date of birth?
Miriam Soler, June 24, 1990.
Okay, great. Thank you, Ms. Soler. So can you tell me a little bit as to why you're here in the emergency room today?
I've had persistent cough. I've been a little bit dizzy, and I've had fevers and chills.
Okay, I see. And aside from that, have you had cough with phlegm?
Yes.
Yes? Okay. So I'm going to be starting off by completing your head-to-toe assessment. I'm going to be taking your vital signs, and then I'll speak to the doctor about what tests he'd like to run, okay?
Okay.
All right, great. Thank you. All right, so we're going to start off with your head examination. Can you turn your head for me? Great, thank you. All right. Hi, Dr. Fernandez. This is Nahara down in the emergency room. I'm here with patient Miriam, who's in bed too. I'd like to call you in about her vitals. Okay, well, her respiratory rate is currently at 24. She's got extreme shortness of breath, fever of 102.3, and she's had a consistent cough with phlegm for the last 6 days. Okay. Okay. Yes, we'll have someone retake her vitals as well within the next 30 minutes. Okay, doctor, I'll call you back with an update. Thank you. Okay, Miriam, so I spoke to Dr. Fernandez. He asked for you to be started on an IV as well as for blood to be drawn for us to run some diagnostic tests. So I'm going to have our LPN Daniel come in. He's going to be starting your IV as well as running the blood work. Once we get the results back, then I'll come back in and I'll explain to you exactly what the doctor found.
Okay.
All right, thank you.
I'm gonna be drawing blood, the tourniquet on. It's gonna be a little tight here, okay?
Hi, Marian. How are you? I'm Annalise. I'm going to be your CNA for today. I brought you some water and ice. Would you like some right now?
No, thank you.
Okay, I'm just going to leave it here on the table. Do you feel comfortable? Do you want me to help you reposition you?
No, I'm fine.
You're fine? Okay. If you need anything, you can call me, okay?
Thank you.
Hello, Marian. I saw your call light went off. Do you need assistance?
Yes, can you help me with going to the restroom?
Yes, sure.
Thank you.
Let me put this down.
Alright, Miriam, so I just looked. The doctor asked for you to be admitted into the floor. You're gonna be staying with us for a couple of days. Once you get up there, we're gonna start with the IV antibiotic. It does come out that you have pneumonia.
Okay.
I'm back. Here to get your vital signs. My charge nurse told me that once we get your vitals, then we're going to send you upstairs, and me and one of the CNAs are going to transport you upstairs.
Okay, thank you.
Let me just get your vitals right now. How are you doing today?
I'm doing good.
Hello, Marion. May I come in?
Yes,
Hi. I brought your food.
thank you.
The LPN told me you would like to brush your teeth. So
Yeah.
after you eat, I'm gonna come back and I'm gonna assist you in brushing your teeth.